action.
Skin-fold thickness measurements provide an estimate of the size of the subcutaneous fat depot, which in turn provides an estimate of total body fat. First, you identify the measurement site and mark it with a pencil. You want to keep the caliper in the right hand and pinch the skin with the thumb and index fingers, avoiding pinching the muscle. Once you pinch the skin fold with the caliper, you read the measurement on the caliper and open and remove the caliper. You repeat this twice with at least 2 minutes in interval. If the second measure differs by more than 10% from the first, repeat a third time.
Grasp a vertical skin fold 2 centimeters to the left and 1 centimeter above the umbilicus. Place the jaws of the calipers 1 centimeter below and perpendicular to the vertical fold. Grasp the skin fold just above the iliac crest at the level of the anterior axillary line along the natural cleavage of the skin fold. Place the jaws of the calipers 1 centimeter distal and perpendicular to the diagonal fold. For men, the chest skin fold is the midpoint between the anterior axillary line and the nipple. Grasp the skin fold 1 centimeter above the midpoint in a diagonal line along the angle of the pectoralis major muscle. Place the 2 jaws of the calipers 1 centimeter below and 1 centimeter perpendicular to the diagonal fold. For women, take a diagonal fold as high as possible on the anterior axillary fold. Place the jaws of the calipers 1 centimeter below and perpendicular to the diagonal fold. The subject stands facing away from the technician with the right arm hanging straight down. The technician standing behind the subject pinches at a site 1 centimeter above the midpoint between the shoulder and the tip of the elbow. Place the jaws of the calipers 1 centimeter below and perpendicular to the vertical fold. Have the subject stand with all of his or her weight on the left leg and a slight bend at the knee in the right leg. Have the subject lift up his or her shorts to gain access to the anterior aspect of the thigh. Technicians often take folds too distally because of the longer shorts. Take a vertical fold on the anterior aspect of the thigh 1 centimeter above the halfway point between the inguinal crease and the proximal border of the patella. Place the jaws of the calipers 1 centimeter below and perpendicular to the vertical fold. Take a vertical fold along the mid-axillary line at the level of the xiphoid process of the sternum. The subject's arm is routinely placed on the testor's shoulder to best gain access to the mid-axillary line. Place the jaws of the calipers 1 centimeter below and perpendicular to the vertical fold. subject can fold his or her arm behind the back to expose the scapula. Once the spot is located, the arm is returned to the normal position. Take a diagonal fold 1 to 2 centimeters from the inferior angle of the scapula. Place the jaws of the calipers 1 centimeter below and perpendicular to the diagonal fold.
Once you have all of your measurements, you insert the data into the equation for the 7-site formula to calculate body density. There are separate equations for men and women. The first one shown is for men, and the second is women. Once you have the body density calculated, you insert that into 2 of these equations to calculate the percent body fat.